Welcome, everyone, and thank you for joining for the first of many events in the Network to Reduce Gambling Harms Learning Series. We're glad you're here. The Network Learning Series offers opportunities to learn from real-world insights, exchange ideas, and build practical capacity across gambling harm reduction sector in Great Britain. As many of you know, and as reflected in your interest in coming here today we're focusing on preventing gambling harms across older adults. Today's webinar is a conversation specifically facilitated by the network with Community Care Gaming. And Community Care Gaming is one of the projects funded through the Network to Reduce Gambling Harms Community Investment Program, which I'll share a bit more about shortly. But as an introduction, my name is Liv, and I'm a senior knowledge broker or senior knowledge mobilization specialist with Grio Evidence Insights. Joining me today is Chisomo, a senior evaluation specialist with Grio, and she will be supporting the tech and moderating the discussion behind the scenes. Chisomo, could you hop off mute for a second and introduce yourself to folks?
Hi everyone, I'm Chisomo. As Liv said, I'll be running the tech in the background, so if you have any questions, feel free to pop those in the chat. If you have questions for our presenters, feel free to pop those into the Q&A.
Thanks, Chisomo. And yeah, we're gonna hop into the agenda now. So this is kind of what we're going to do today. We are going to start off with a brief welcome from the network and just ground us in what brought us to this learning event today. From there, we're going to move into a conversation with Community Care Gaming, which we're very excited about. And at the end, we've set aside specific time to talk about any questions or reflections that you might have. And then we'll wrap up from there. So to get us started, I want to highlight a few ways that you can get the most out of today's session. So first of all, if you would like to enable live transcription or closed caption, you can do that using the icon at the top of your Teams window. Just click the three dots under More and scroll to Language and Speech and select your preferred option. We'll also be using a couple of interactive polls throughout the session. We will notify you when those are happening. They'll pop up on your screen. They're anonymous, and we really encourage you to take part. Like Chisomo said, the chat is open, so please feel free to share reflections or comments as you go. If you do have questions specifically, posting those in the Q&A would be really helpful because there's so many of us in today's meeting. We're going to be moderating those, and at the end, we will take some time to talk about some of them. And all of your mics are muted just because there's so many people, so the moderating through the Q&A would be really helpful if you could post your questions there. We're also committed to creating a respectful and welcoming space, so questions or comments that include harmful or hateful language will not be shared or admissible in this setting. And a quick note that overall today's webinar will be recorded and we will share the recording on the network's website in the coming days, so you can rewatch it or share it. Yeah, just before we go into Community Care Gaming and that conversation, I want to take a few minutes just to share a bit about the Network to Reduce Gambling Harms and how we got to this webinar today. So first of all, a welcome from us. At its core, the Network to Reduce Gambling Harms was created to strengthen how we share insights, build partnerships, and support action to reduce gambling harms across Great Britain, with a particular focus on at-risk and underserved communities. It brings together people and organizations from across the sector, in the public sector, third sector, academic sector, all working towards a shared goal of preventing and reducing gambling harms and lived experience as well. The network creates structured opportunities for collaboration, learning, and collective action. This means that we work together to advance shared priorities to address gambling harms, support and fund community-based organizations responding to local needs and priorities, and build a stronger understanding of what works across policy programs and practices. Specifically zoning in on the Community Investment Program, which is one of the network's great activities. The Community Investment Program provides funding to organizations working with at-risk and underserved populations, specifically to build capacity and strengthen community resilience to gambling-related harms, respond to needs across prevention, education, and treatment, and integrate gambling harm prevention and support into existing policies and services. Community Care Gaming's project is one of the 7 initiatives that was funded through this program. And in addition to the funding that projects received, they also receive evaluation and knowledge mobilization support. So through this project, Chisomo and I have had the opportunity to work closely with Lee and Adrian, supporting the delivery of their project with evaluation and knowledge mobilization. And this collaboration ultimately led to the creation of this webinar, which provides an opportunity for us to dialogue together and also share insights and perspectives with you all, which we're excited about. So let's move into the conversation that we're all here for. We're really looking forward to hearing from Lee and Adrian about the important work that they're doing. So I'm pleased to introduce them. Adrian and Lee are two incredibly passionate leaders in the gambling harm prevention space, working in community care gaming. Adrian brings over 35 years of experience in the education sector with a focus on designing training, workshops, and qualifications. Over the past 12 years, he has also been deeply involved in gambling harm prevention and reduction. Lee brings more than 20 years of experience across executive, board, and strategic leadership roles in the gambling, charity, health, education, and technology sector. He has also spent the last 12 years focused on safer gambling and brings powerful lived experience, which he transforms his own journey with gambling harms into recovery and support for others. And while their current work is focused on older adults, this hasn't always been the case. Lee and Adrian first began working together when they co-founded YGAM, an organization that many of you might be familiar with, which is focused on supporting young people with gambling harms and prevention. Today, Community Care Gaming, they're applying their expertise to support older adults, which overall brings a truly cross-generational perspective to their work. So without further ado, I am so excited to kick this off to Lee and Adrian. And Lee, I would love for you to take this first question and tell us a little bit more about Community Care Gaming.
Yeah, thank you, Liv. And quite an introduction there for Adrian and I. Thank you most warmly. Yeah, we're just very humbled to be able to contribute to this sector, something we both passionately believe in, and we've been doing, as you said there, for over 12 years. So Community Care Gaming, we set the organisation up with a couple of other colleagues about 3 years ago. We're incorporated as a community interest company, not for profit. And I guess in that 3 years, we've been trying to find our niche and trying to find our place. There's lots of great organisations doing amazing work in this space. And I guess the areas that we've sort of zoned in on are looking particularly at the over 50 demographic. And we'll talk a little bit more why we've chosen that demographic and some uniqueness about that. And also, sort of related but unrelated, Adrian and I go to care homes every single week, folks. So we actually go to care homes and we take virtual reality headsets and we deliver immersive experience to the residents to combat loneliness and social isolation within those care homes. Look at if that type of technology can help with stroke rehabilitation as well, and also can it help with patients or clients suffering from dementia. So complementary in terms of tech, but also quite different in terms of what we deliver. And it's been a great couple of years, hasn't it, Adrian?
Yeah, absolutely wonderful. Should we move on to the next slide then, please? So yeah, it has been a great couple of years, and it's interesting how we arrived at this project. Something that seems to have happened to me quite a lot recently. I've been standing in a queue at the supermarket services, and I've been behind someone who's probably retired, probably on a pension, and I've observed them spending loads of money on lottery tickets, £50 on lottery tickets in one go, and then followed up by £50 on scratch cards as well, which they've actually scratched at the counter. And it got me to wondering about how widespread is this an issue amongst over 50s, and retired people as well. And if you begin to start thinking about it, as we will this afternoon, you'll find there are a myriad of reasons why older people are gambling. So we thought, rather than prejudice the case, as they say in a court of law, what we would do this afternoon is start with all of you lovely people out there. And I see we've got a very nice crowd of about 30. And we're going to do a little kind of word cloud that Chisoma's going to set up. And that's, why do older people gamble? And as ever, Lee and I have never come to prescribe an agenda. So if you can think of positives, then great. And if you can think of things that are less positive, then that's equally valid. So a bit like a game show, if you can hit that button now and submit your response, we might get an initial picture of what you think before we come and tell you what we know. So Chisomo, let's do that, shall we?
The poll is up. You should be able to see it on your screen, and I do see responses coming in.
That's
we
good.
see older adults might gamble for social interaction, if they're experiencing loneliness, financial hardship, socialization, which is similar to social interaction. They want excitement or fun, a distraction from stress, pleasure, boredom, out of habit, for hoping for better, stretching income, hoping for a win. So a lot of different aspects there, but definitely the social aspect is coming out quite strongly.
That's excellent, and thank you for that. That, as we say in gambling parlance, was your starter for 10. And it is weird, isn't it, how much gambling language we all use in our everyday lives and in our work as well. So on that theme of gambling, let us proceed to the next slide. And Liv, back to you to ask the questions.
Yeah, so I mean, you've worked with youth before as a priority population, and some people wonder, why are you focusing on older adults? Like, why does this matter as a priority population? So we'd love to hear more about that and building off the word cloud.
Brilliant. Okay, then. So I've got a couple of slides here to share, everybody, which sort of sets out, I guess, the rationale for our project, number one. Number two, we're going to take a bit of a deep dive into the evidence. So what's the evidence telling us, and does that complement the rationale that we had? And then finally, we're going to take a bit of a dive into the theory of change. And those of you who work within the charity sector or the third sector will be very familiar with that change model. So over the next few slides, I want to unpack some of that. Firstly, the rationale. Adrian and I, working with a great team at Agrio, we didn't want to produce a project for project's sake. For us, it's all about creating a legacy. It's all about being evidence-led, and it's all about, when I talk about that legacy, it's actually being able to continue this work. It's not a sort of a one-hit wonder. Actually, it's about training professionals, and I'll come on to how we do that in a moment. So why we picked on the older demographic? Well, I think sort of 12 years ago, Adrian and I were very fortunate to work together to establish the previous organisation that I set up, and there wasn't hardly anybody doing stuff around young people. And what's been really, that's educating young people, and what's been really pleasing to see over the past 12 years, is far more organisations now doing education around gambling harms with young people, either direct delivery or through a train-the-trainer model as well. And that's been brilliant to see. But when we started looking at this, we did come to the conclusion rather quickly that nobody's looking at that over 50 population. And I'll go through some of the stats in a moment, really. So that's some of the rationale. If we go to the next slide, then please. And then let's just take a bit of a dive here into some of the data, being data-led, being evidence-led. As you know, it's going to be really important for us. And if you go to our website, communitycaregaming.org, you'll see on there's a research hub. And on that research hub, we've got well over probably about 20 different research papers as well. And quite a few of them are relevant to this particular cohort, the over 50 cohorts. I guess we've organised our data and our evidence into the 5 buckets you're seeing there on the screen. Risk factors was really important to us, because actually we really wanted to understand, is this actually a risk for young people, like it is a risk for, older people, sorry, like it is for younger people. Preferred games, again, stereotypically we think of older people and we think of bingo hall, but actually, is that true? Again, we've done a lot of research to understand that. And then the final one for us, which is quite interesting, is motivations. And again, there's quite a lot of research we've produced around that, and trying to understand the differences between the motivations for older people versus younger people. In the UK, you probably know there's about 69 million people. That's our population, and 22 million are over 50 years old, which makes it about 40% of the population. And we have an aging population, as you know, both in the UK and globally. Of those 22 million older people, there's about 360,000-ish who are living in residential care or care homes. That leaves a significant percentage of the population who are living at home, some with family, some with friends, some with their husband or wife, but quite a lot of people are living alone as well. And if we look at that loneliness data, there is about 2 million people, older people in the UK, who are suffering from loneliness and social isolation, and about 1.4 million in addition who have acute loneliness. And we'll touch on loneliness in a moment when we look at some of the data. Next slide, please. So we've understood the data. Some great reading, folks. A bit of homework on the website for you, so please do have a look. So now, how do we approach this? So I was very fortunate to work with Adrian 12 years ago, as you know, to establish a previous organisation. And there we specifically decided to go down a train the trainer model. As a person with lived experience, and I believe there's other people on the call today with lived experience, there's nothing more proud than going to an organisation and sharing your experience with gambling harm in a way to inspire the audience, in a way to raise awareness. It's just brilliant. But I guess the question for us is, whilst that may be good, does it leave a lasting legacy? Back to my earlier point. And that legacy for us is having a trained person in an organisation who can continue your lived experience story when you have left that organisation. So if you think about those care homes, actually having a trained person in care homes who can embody and deliver that safer gambling message year round is going to be really important. So that's how we landed on the train the trainer model. Many of you will be familiar with the work that Adrian and I did. We've been groups of people to a venue for an inspiring day of learning. Evidence-led and with lived experience, lots of activity, lots of practical stuff. And again, we're going to emulate that as well within this program. Some of the knowledge, some of the topics rather, are on the slide just there. And in a moment, Adrian will take a bit of a deeper dive into some of the content of that particular program. Next slide, please. So my last, 3 slides, we're going to just take a bit of a dive into this thing called a theory of change. Every organisation working in this space really needs to have a theory of change, and it's a really good, evaluation or thought model. And I'm particularly grateful to Sumo, who has been absolutely brilliant and really helping us to think through, what's the program content? How do we measure the program's success? What are the short-term outcomes, and what are some of the medium-term outcomes? And we've put some of those on the board just there, on the slide just there rather. Those working in this space, a lot of those points there will be familiar to you. Next slide, please. And then the long-term output, so the long-term impact rather. So in an ideal world, same as young people's programs, we'd move towards a longitudinal study. That will be the absolute creme de la creme. And I do hope that certainly in the next sort of 15 years or so of my working life, that I'm involved in a longitudinal study of some form to really understand the impact of prevention education within this space, whether that's young people or older people. But when you set up an organization, again, as many of you will know, that evaluation, it's a journey and it's baby steps, and everything you do, you're getting better, you're developing your knowledge, you're developing your evidence base. And what's important for us is taking people on that journey. So a longitudinal study would be absolutely brilliant, but we have put down there a bit of a long-term impact and some of the success measures. And I'm hoping that we'll be working alongside Swansea University to develop this evaluation further, produce a really insightful report that we want to share both what's worked well, what hasn't worked so well. So again, this sharing then coming out to the community. Next slide, please. I think the next slide just pulls out some of those success measures. And again, grateful to Sumo for your help, because there's probably lots of success measures that we can measure, and actually having a real laser focus on the 5 there gives us something tangible to measure the program against over the year. And the last 2 slides from me is next one is just again in preparation for this project. Adrian and I, we said earlier, go to a lot of care homes, amazing, but also very, very eye-opening as well. And we spend quite a lot of time actually speaking to residents in those care homes, speaking to healthcare providers, speaking to families, to children, to grandchildren, to really understand, what are people's concerns about gambling and the over 50 population. As you would imagine, listening groups we've had with the grandparents and the parents, definitely savings and pension has scored highly. But then for the individual people themselves, those over 50, some of the other things on the board has also scored quite highly. And you'll be surprised, well, you may not be surprised actually, but if you go to a care home and you look at the weekly programme, bingo will absolutely be a regular programme every single week on that within that particular care home. So again, gambling could be said is actually normalized within care homes. So we want to understand, is that then presenting risk? And the final slide from me is just about some of the signs. So these are some of the signs. You'll all be familiar with them, and Adrian will talk to them in a moment. But these are some of the signs to look out for, and some of the things that we are certainly talking to some of those care home managers about in terms of providing a safeguarding place for your residents. I guess there's one missing on here, and that's, again, it's come through our research and talking with people, is medication for Parkinson's disease. So medication for Parkinson's is really common, whether about, there's a couple of different brands you can use there, but those particular medications convert dopamine in your brain or stimulate the dopamine receptors as well. So again, it's that sort of stuff that we're quite keen to draw out from this project that may be different to young people or any other groups as well. Thank you, Liv. Over to you, I think.
Yeah, thanks so much, Lee, for that. And if there's any questions coming to your mind as Lee is sharing and you want to dive deeper, please do feel to put those in the Q&A and we could dive deeper later on. But a big part of your project with Community Care Gaming is that you're working to implement a training, which has been touched on, and we get the opportunity to learn about that a little bit right now together. So Adrian, can you tell us a bit about the Train the Trainer training that you'll be running in the next 6 months? Oh, you're muted, Adrian.
There we go. The wind was blowing, howling around my office, so I turned me off for a while. So yeah, here we are. So yeah, a little bit of context really around this. As Lee said, when we started 12 years ago on youth gambling, not a lot of people had kind of thought about the issues there, and even going to one university. The Vice-Chancellor said, "What serendipitous series of events have brought you to my door? We haven't got problem gambling here." Well, you can hear by the sound of that rhetoric that maybe it was a little bit misplaced. Brilliant, we've got all these people on the call, which suggests that a lot of you are not coming late to the party, but are absolutely understanding the reason for doing this project. But even now, I've pushed out emails to people, some well-known groups that work with the aged, who said, "Nope, I've never heard of old people and gambling harm. It's not on our list of priorities." So we're going to have to push hard for this project, folks, to make sure that we reach the parts that other projects don't reach. So the overview of this project, as we put it to GRIO back last year, was that we wanted to train 100 professionals from a broad church indeed. And we would then ask them to go back and work with their community of 20 people on average, thus delivering the magic number of reaching 2,000 people approximately. And I will talk more about those numbers a little bit later. But we are looking at a very broad church, from all the people I see on the call here today who might already work in this sphere, to dementia lunchtime clubs, to stroke rehabilitation units. It's a massive piece indeed. So anybody who touches the kind of over 50s and over 60s demographic is interesting to us. And one of the things that is not lost on Lee and me is a project aimed at the over 50s actually includes us. So it's quite germane and quite quite ironic at the same time.
Thank you.
Maybe I know I betray secrets every time. I'm such a gossip. And maybe some of you on the call here today are in that over 50 demographic as well. So, you know, it's got a kind of a real rationale for all of us. But what are we going to do? Well, we're going to try and run some of the trainings at the Hippodrome Casino, which is what we did historically many years ago, where we brought people to look and see what gambling really looks like. So that's where we're going to try and run some of the sessions. We're also, for those who don't want to go near casinos, and we understand that, we're going to run some nice online sessions as well. And finally, we're going to work with a couple of groups who've already come to us and said, can we have our own session? We'd like you to come to Brighton, or we want you to come to Norwich. So that's the kind of the picture at the moment, and we are going to put some dates into the system a little bit later. But imagine you're coming for the day's training. We're going to do the introduction, who we are, why we exist. We'll look again at that rationale that Lee has explained. What is the background to this? What is the data on this as well? But crucially, like any good training, it shouldn't just be something where we're speaking at you. We actually want you to engage in conversations, just like you did with the word cloud. We want to hear about your own experiences. Is it the same as mine? Is it what you've seen out there in the shops? Is it what you've read in research papers about women over 60 gambling on betting on bingo sites in the afternoons on their laptops? Or is it actually a positive story of your grandfather who loves going to the horse racing and gets a real kick out of it? So there are definitely a lot of different dynamics to this. Again, we can always kind of think about, you know, social isolation, drugs that are, you know, affecting our minds, even pension shortfall. But the evidence also says that by doing gambling, it's great for your cognitive function if you're, you know, turning those numbers in your mind and doing stuff like that. So we really want to engage with your experience and come to some understanding of what it looks like across the board. If we're not doing this online, we will give you lunch. That's always a good thing. And when we go to the Hippodrome, we take lunch and we actually look at the gambling floor and we see what real gambling looks like. And 12 years ago, when Lee said to me, shall we do this project? I had never been near a casino. I'd never been in a betting shop. And all I knew was my wife once bought a lottery ticket and lost. That was my experience of gambling. And maybe it's yours too. So it's an invitation to come and learn. In the afternoon, we'll also look at some case studies. Try and get a view on what we should be doing with people who might exhibit some signs of problematic gambling. Where do we send them? As Lee said, what are the signs? What is our advice? What are the links to different groups who are out there who can provide help and support? And finally, some training activities so that we prepare our 100 trainers to go back to their community and be armed to deliver a program from 1 to 2 to 3 hours, depending on how long you've got. And again, we are not naive enough to think that everybody has a whole day to work with their community. From our youth experience, sometimes it's just half an hour, but to get that message out there. So how are we going to do that, Liv? Well, let's go to the next slide. So then, how to deliver the program. You've been to the Hippodrome, you've been online, we've come to see your organization. And so now you're going to work with groups of around 20 people. And it may be, you know, on one occasion you got 5 who come in. When I was up at Watford Football Club last week with Golden Memories, I think we actually had 20 people in the room for that. So, you know, you tell us who you're training. I think it's true to say that the older generation do not want to be lectured, nor should they be. They've been through a lot. If they're like my mother, they've been through the war, you know, so we've come to have a conversation with them and to get their reflections on this, good, bad, or indifferent. So this is conversational and not didactic, said the former English teacher. We are encouraging conversational approaches, round table format. Again, something we've done for years now is around confidentiality. If you don't want to talk about your gambling experience, you don't have to. You might even want to invent one, who knows, to make yourself more interesting. Again, you've got all the people on the call today. You've got a lot of expertise, I can see from the names on the list, but you'll also have, when you go to your community, your own experts. And I have a little acronym, HEIR, AIR, harnessing expertise in the room. And we'll be asking people to say, what's your experience of 40 years of horse racing? You know, you might know a lot more than we do. So essentially, we're an education program. Lee and I have both come from an education background, and that is our belief in how things work. We're not anti-gambling, we're not pro-gambling. As I said, I'm a non-gambler, so I can duck out of that conversation. But we want real experiences, real conversations. 4-hour duration would be lovely, wouldn't it? As I said, but we may not get that. One of the crucial things is that Lee mentioned Swansea University, who we hope will be our research partners, will be helping us gather feedback both before the training, after the training, and when you engage with your community. So we'll have a breadth of information, data, quantitative and qualitative, which we can then begin to analyze and put out there, excuse me, so we better understand what's going on. Because although our lovely colleagues at GRIO have got a vast library of research, and there is some great stuff on old people, a lot of it says, like Donald Rumsfeld, we don't know the unknowns. There are known unknowns at the moment. You know, we can put numbers on some stuff, but not on others. So we are groundbreaking. I'm hoping we are thought leaders in this area. Next slide, Liv, please. Okay, so what else are we doing beyond the training, beyond arming you with some slides to go out there and deliver? So our website, we'll put that link up there shortly. We'll have a support section, including 5 bespoke films. We've got 5 experts from addiction, gambling therapy, from the industry, from mathematics, probability and luck, and also from therapy. So we're going to make some really good films in the next couple of months that you'll be able to show. Again, with the older generation, we want things that you can actually use easily. You can send them, they can watch them on a phone, on a tablet, when they're with you. We'll do some more infographics with our design team, so that again, you can share stuff quickly around those 5 key areas. We'll have an index of support organizations. I think it's true to say that Lee and I have worked with a lot of you over the years, again, looking at some names on there, so we know the best place to point you. And clearly you'll get support from us if there are any issues in terms of delivering the program. I will be on hand to help you, just like Chisomo's been troubleshooting today. I will be chief troubleshooter on this project. So how to get involved, Liv? Can we move on to the next slide? Oh,
Yes.
I've nicked yours.
There you go. Yeah. Yeah, that's such a great program, and we're really excited for you to launch it. And yeah, it'd be great for people to have a bit more tangible information about how to get involved.
So super. As you will have seen, training starts in autumn 2026. We're just trying to confirm those dates, but most likely October, running through to February. And I say that'll be a hybrid of in-person and online. You can register your interest at the website that we've produced there. And I'm thinking that we're going to put this into the chat in a moment, so you'll be able to save that link. Thank you, Chisomo. That is brilliant. I thought I'd be coming along to this webinar today to say that we've got 100 places all ready for you. guess what? 50 of them have already gone in conversations I've had before this. So my message to you is that if you want to get involved, please do, but do it early, because actually, we might go beyond 100. We're not saying that's an absolute limit, but I would hate for you to miss out on this. London and South East venues, virtual training, and our delivery window for you to go and work with your community, that would last until April 2027, depending on when you came and trained with us. So we're not dealing in too many absolutes, but at the moment, that button, get involved, is about pre-registration. Get your name on the list, and then in a few weeks' time, when we've just firmed up those dates, then you can begin to think about when you'd like to come to London, when you'd like to be online. Or you can also message me if you'd like to do something more bespoke and you'd like us to come to you because you've got 10 members of staff who all want to do this. So we're uber flexible on this, Liv.
Amazing. Well, thank you
Thank you.
so much for the presentation. We've left a lot of intentional time at the end here to be able to have conversations from the audience with Adrian and Lee. So we have about 15 minutes to ask some questions. We have some great questions already in the Q&A. If there are more percolating in your head, please feel free to drop them in the Q&A and we can ask. I know also that a really big part of the network is to build connections, and I know personally that Lee and Adrian would love to connect with you outside of this space if we don't get to your question today. So just keep that in mind. And at the same time that we have this Q&A, we're also going to launch a poll, and I will just ask you a few questions about today's webinar. I noticed earlier that there was a bit of difficulty when the poll launches. It can hang out on the screen for a bit. There's an X at the top right corner of the poll that you can just close that poll at any time, and you can find it in the chat. So if you have any trouble though, Chisomo and I will help you. But without further ado, I'll kick it over to Chisomo for the first question.
Yeah, so as Liv has said, we've had some really great questions come in already, and please feel free to keep them coming as you're thinking of them. But the first question is, have you looked at how older people can be impacted by gambling, by the gambling of their adult children or others, and how that might lead or contribute to elder abuse?
Yeah, so it's a really good question, actually. It's that sort of affected others question. So for this project, we haven't, but it's something, I guess, that we've been collecting through those pre and post surveys as the project just developed, really. I think when we did some sort of consultations in care homes, that did come up quite a bit. So it's something that, yeah, absolutely on the radar, and it feels like it might be a sort of a step two. And if there are organisations, which I think there are on this call, that specifically work with affected others, again, it would be great for us to have a conversation offline to see if we can start to create something that we can then put forward for a funding application.
Yeah, if I can
Adrian?
just, if I can follow up on that as well.
Yeah.
One of the stories again that put me in mind for running this project was of a lady who'd actually she'd blown all of her savings on gambling, and I think it was her son or her sons who were expecting to inherit, found that, when push came to shove, there was no money there. And I think that is a side reference to the question we've just asked in terms of the pressure of older people to keep their money safe and not indulge in what we might see as behavior which is more dangerous, more risky, and that the money's not there. So, I talked about pensions earlier, but there's a huge flip side to this whole argument as well about, how the generations do understand each other, and again, how that harm can be populated from one generation to another. So it's a really good question. And I think, as Lee said, there's a lot more to unpack in this project.
Absolutely. I think that's an excellent point, bringing up the affected others for sure. And we have a few other CIP projects that do focus on affected others as well. So there's a nice connection there. Building on sort of what other factors could potentially support or prevent someone from experiencing gambling harms, Could you talk a little bit about any particular life transitions that older adults might experience, like retirement or bereavement, perhaps reduced mobility that might increase or correlate with an increase in vulnerability?
Yeah, if I start this one, Lee, is that okay?
Mm, brilliant.
Yeah. So a lot of you will be familiar with the acronym ACE, Adverse Childhood Experiences. And we spend a lot of time thinking about those, but we don't have the equivalent of adverse adult experiences. And if you begin to think about what happens to us when we're in our 60s, there are a series of kind of seismic shocks that can occur. One is retirement, stopping work, stopping that engagement with people, stopping having a sense of purpose. Sadly, it's more likely that things like illness will creep up on us as we come to a older age, whether that be cancer, whether that be dementia. Sadly, bereavement is another thing that will come up. We might lose our life partner, we begin to lose our friends. And finally, just when it comes to finance, we might not have as much money as we wanted to have going into our retirement. So there are all these kind of things which can really, really scramble the brain and make us behave in ways that, we may not have thought we would do when we were 10 years younger. So that's certainly my perspective. But Lee, I'll hand it over to you.
No, just to build on it, and it's that escapism. So what Adrian's articulated really well there is that escapism, and that's what obviously gambling can provide. And for some people, perhaps if you're on that medication for Parkinson's, that can be quite a risky combination. So yeah, it'd be interesting to look at that part of this project.
Fantastic. Another wonderful question here. So it was also posted in the chat. From this individual's praxis, they were working in implementing smoke-free policies in care homes. And they used to be told that they shouldn't take away older adults' lost pleasures. However, research shows that older adults want to and can quit smoking much later in life. So could you say a little bit more about how this might fit in this concept, essentially, of not taking away pleasures, but folks, of course, being able to essentially adjust their behaviors later in life, and how that fits into how gambling harm might affect older adults?
Yeah, so I'll go first on this one, Adrian. It's absolutely the cornerstone of community gaming that we are not anti-gambling or pro-gambling. And as some of you will know, in the UK, there is a levy system being established. We actually, as an organisation, chose not to apply to the levy because we didn't want to. We don't disagree that it's a public health issue, but we didn't want to sign up exclusively to that because we didn't know the consequences for an older population. So for us, as I alluded to earlier, bingo is a common thing that happens in every single care home every single week. So I don't want to take away that pleasure at all. It's all about training the professionals so they have got the skills, the confidence and the knowledge. So when they deliver their activities, whether it would be a bingo or they actually all go off to the local bingo hall, they've got, I guess, the tools and resources just to do that safeguarding piece with those within their care. So we're not saying don't gamble. We're not saying do gamble. What we're saying is those who choose to gamble, you need to know some of the risks and you need to know some of the support organisations. And I see, for example, GamStop is on the line as well, on the call as well, rather, and it's Katie's organisations like that as well we want to really illuminate as part of this project as well. So that people are made aware, because I guess if you go to a care home and you say, have you heard of GamStop? 90% of people will say, no, we haven't. What is that? So again, it's about sort of illuminating some of the support organisations out there.
Yeah, I think
anything, Ajin?
Yeah, to add to that, I think context is everything. With regard to the work we were doing, like I mentioned last week in Watford, there was a huge variety of older people, some with dementia, some with coming back from stroke, some just refusing to speak or whatever. So although in an ideal world the analogy of the smoking is something one can clearly see has a logic to it. The context of being in a care home or being with your community, you have to kind of gauge, where you think that message lies. Clearly, moderation is always the answer. And as relatives, again, this is something where we need to engage for you to be able to ask the questions of your family who might be slightly older. But I think my clearest point of reference with this comes back to the whole piece about being in the supermarket. I have actually asked on one occasion of the supermarket staff, are you, able to give people a message about, do you think this is right? Do you think you should be doing this? And most of them, the answer is no. They have no training. They have no responsibility in this place, and also the sort of no moral pressure to do it. Now, I get that because I'm living here in South London, and if you start an argument with a customer, you might be on the wrong side of it. But there's got to be something in there whereby we are taking better care of our older people in some way. So this project, I think, maybe has to look at delivering on that with the gambling operators at some point.
Brilliant.
Absolutely. Adrian, you opened with this story about the supermarket and you brought it back again. And you touched on, folks might be betting on the horses or they might be going to bet shops or off license. So some of these land-based essentially venues for gambling. But could you talk a little bit more from your experience and sort of what you know about how the shift to online gambling for older adults might be impacting essentially how they gamble or how they interact with different gambling types?
Yeah, it's a really interesting question, isn't it? Because I think a lot of older people do stick with what they know. I'm going to be walking my dog in half an hour, and we're going to go past Ladbrokes betting shop on my high street. And I know that, in there, I'll see the older generation, mostly blokes, nearly always blokes, actually. And they're doing what they've been doing for a generation or more. And the same with people who like going to bingo or horse racing. There's a sort of hardcore that's there. But as Lee alluded to, we're an aging population, and we've got more people coming through now to the over 50s and over 60s who are digital natives, and therefore they haven't got so many issues in terms of switching to online. That is not to say that they absolutely understand what they're doing. And I'm a great fan of educating customers of whatever age. And if I'm going to onboard somebody age 60 onto my online gambling platform, I really should be checking in with them, about they understand the rules and regs. Again, part of the title of our project is about vulnerable customers. And again, particularly with online gambling operators, there's a duty of care to understand vulnerable customers that I'm not sure is always there at the moment. So there is that. And then, of course, the threat of the black market, which we haven't really talked about today, but elderly people being lured to unlicensed gambling sites because they don't know what is regulated, what's unregulated, and they get themselves into trouble. So again, there are all sorts of dynamics spilling out of your question, Chisomo, which is a very apposite one.
Thank you for that. Building upon the sort of delivery of the Train the Trainer program, can either one of you talk a little bit about any barriers you might have been facing in sort of delivering the program or building out the program, and any barriers you sort of anticipate as you look to scale the program as well?
Gosh, it's a good question. I mean, you will know that from our conversations that we've been having on a regular basis that my big concern of all these projects is sustainability. I've worked on European Union projects for a very, very long time. 2 years of funding comes, people rejoice in accepting it, and then the end of 2 years, they all run away and go to the next project. And I think for this project and all of the other kind of GRIO funded projects, sustainability is going to be the big issue that we're addressing. And it's like a stick of rock, the words running through a stick of rock for me. Every time I think about this project, I think not just about the now or in the autumn, but I'm thinking about next year and how we sustain that, because 2,000 people will be great, but it barely touches the sides, right? So how are we going to scale that? How are we going to keep on going? And Lee and I'm glad to say, already have some great thoughts about that. But we'd love to hear from you on the call today as well, if you'd like to talk to us further about it. Lee, I'm guessing you might want to put in a different perspective.
Yeah, not a different one, Aidan. So it feels like 14 years ago when YGAM was founded, we sat in a coffee shop. We had no money. We had bags of enthusiasm. We had an idea, but we had no contacts. We had no links, and we quickly realised there was appetite for this project, for that project role, work with young people. Again, our critics would say, "Oh, you're teaching kids how to gamble." They were obviously uninformed critics. They didn't really understand about the curriculum or what we were trying to do. So it feels like almost we are starting again. So we've got a good idea. We've worked with the team at GRIA to get good data, evidence, good theory of change together. And I guess the focus needs to be on delivering this well, which we will do, number one. And then when we look to scaling, so some of you may be familiar, again, in YGAM, I work with GamCare, and we were able to scale both GamCare and YGAM and all of YGAM's partner organizations as well, and deliver a very comprehensive national education program that has reached, 6 million young people in the United Kingdom through that the trainer model. That was an investment of £10 million needed to do that. And when you think, wow, that's a huge amount of money, it's a colossal amount of money. But when you think of the statutory levy, and when you think of the money that's flowing in now from the operators as a tax effectively to fund that levy, sustainability is critical. And I think if we deliver a project really well, then not just our organisation, but again, I just mentioned GamStop because they're on the line, but there are a plethora of other organisations. We ought to all come together and look at some sort of strategic grant to OHEAD or similar to get that national coverage. Having scaled an organisation from an idea to reach millions of people, it's an incredibly challenging but equally rewarding thing. So I think we've got a bit of experience, and I'm quite keen to work with, or Adrian and I rather, are quite keen to work with others on the call to realise that ambition. If somebody was to say, what's the ambition? I think when I was sort of in YGAM, the ambition was it to be in every single school and to be in the national curriculum, and it was achieved. If I now look at community care gaming, it's to be in every single care home across the country and embedded into the gambling plans for every single local authority. So we have absolutely got a very clear vision. The really interesting bit will be working with partners collaboratively to scale. But let's deliver one project well. Let's get it well evaluated. Let's take learning, and then, my goodness, let's scale. Brilliant. Good question, by the way.
Yeah,
whoever posed that question, we'd love to have a conversation with you off the back of this.
Absolutely, yes. Scalability and sustainability are always a huge issue with any funded project. And it is definitely something, sustainability, that's top of the mind of GRIA as we're delivering the network. And you'll see at the end of this presentation, you can link to our website, but you'll also be able to see on our website some of our information that outlines essentially the phases of the network. And the third phase is about mobilization and sustainability. And so you'll be able to see some of the activities we plan to engage in to do just that. Just looking at the time, I'm going to wrap us up with one last question. It's a little bit of a two-parter. So looks like you have some interest for folks to deliver an online session in Greater Manchester, if it would be possible to deliver an in-person session.
We can have a look at that. Yeah, please just get in touch, drop me a note, and we can take that conversation forward. I love Manchester, so when it's not raining.
Excellent, yes. And then the second part, will the report be developed on the findings, and will it involve a formal evaluation of these interventions?
Wholeheartedly, yes. That's why we are partnering, hopefully, with Swansea University to do that. And as some of you may be familiar, Swansea University are part of the Glasgow University Consortia alongside Sheffield University that are going to be delivering the Gambling Harms Research Centre, and they've been awarded the £10 million UKIRI funding to do that. So again, plugging into that university for us strategically was really important, because that means that we can, again, talking about building collaborations, we can build out collaborations then with those partner universities who are delivering that.
Wonderful, thank you. That concludes our question period.
Thank you, everybody.
Amazing.
Really good questions.
Yeah.
Brilliant. Thank you, Liv.
Great
Brilliant.
questions.
Thank you,
Thank you everyone so much for this amazing conversation. And I just mentioned that the poll that we created is can be found in the chat if you didn't already fill it out. I just posted a comment, and you should be able to see it just above there if you want to take a couple minutes to just do that before we wrap up. But a couple ways for you to stay involved with the network. On top of reaching out to Community Care Gaming today, if you would like to get in contact about a training or contacting Lee and Adrian specifically, you could also stay in the loop for network activities. We're going to be doing more learning events coming up in 2026, 2027. And an easy way to stay up to date with those events is to sign up to our newsletter. So you can do that by scanning the QR code here or going to our website. But yes, we will be doing more learning events on priority populations and priority topics such as this going forward. And we will also be launching a community of practice in the fall, and it will be a dedicated space for peer connection and shared problem solving in the gambling sector. So stay up to date on that if you follow our newsletter or just follow us on social media. And if you have any opportunities that you would like us to share widely with our network, for example, new research or an event that you're hosting, or if you would like to be spotlit in the newsletter, please contact us. We are a participant-led organization and always want to hear from community and promote community. So we'd love to stay in touch with you. But we're just so grateful that you came today, and I know it's been such an exciting opportunity for us to get to have this time with you all, and I know it's been really exciting for Adrian and Lee to this project and us to work with them. And so we just want to say a big thank you, and we will be posting this recording in the coming days. But otherwise, I hope you have a fantastic rest of your Wednesday and a great rest of your week. Thank you so much.
Thanks, everybody.
Thanks,
Bye-bye.
everybody. Good to see you all. Brilliant.
Bye-bye.
Thank you.
Bye.